Diagnosis and Management of Iatrogenic Endoscopic Perforations, European Society of Gastrointestinal Endoscopy Position Statement, Update 2020. Introduction. This position statement updates recommendations issued by ESGE in 2014 regarding iatrogenic perforations occurring during gastrointestinal (GI) endoscopy, not including purposely performed perforations. As in 2014, these recommendations are defined as a position statement rather than a guideline because of the scarcity of high-quality studies, mainly due to the rarity of iatrogenic perforation. Iatrogenic perforations are rare but severe adverse events, therefore adequate diagnosis and management are of paramount importance. Methods. ESGE commissioned this position statement. The development process included meetings and online discussions among members of the project committee during February 2019 and December 2019. Subgroups were formed, each in charge of a series of key questions that were clearly defined using PICO, population, interventions, comparators, outcomes, methodology. The project committee chairs worked with the subgroup leaders to identify pertinent search terms that included iatrogenic perforation, endoscopy, clips, surgery, as well as terms pertinent to specific key questions. Searches were performed on Medline via PubMed and the Cochrane Central Register of Controlled Trials up to October 2019. This time point should be the starting point in the search for new evidence for future updates to this position statement. Articles were first selected by title. Their relevance was then assessed by reviewing full-text articles, and publications with content that was considered irrelevant were excluded. Because of the lack of well-designed studies, quality of evidence and strength of recommendations were not formally graded. Each subgroup developed draft proposals that were presented to the entire group for general discussion during a meeting held in October 2019 in Barcelona, Spain. Further details on the methodology of ESGE guidelines have been reported elsewhere. In February 2020, a draft was sent to all group members for review. The draft was reviewed by 2 external reviewers and then sent for further comments to the ESGE national societies and individual members. After agreement on a final version, the manuscript was submitted to the journal Endoscopy for publication. All authors agreed on the final revised version. This guideline was issued in 2020 and will be considered for update in 2025. Any interim updates will be noted on the ESGE website. Summary of recommendations. ESGE recommends that each center implements a written policy regarding the management of iatrogenic perforations, including the definition of procedures that carry a higher risk of this complication. This policy should be shared with the radiologist and surgeons at each center. ESGE recommends that in the case of an endoscopically identified perforation, the endoscopist reports its size and location with an image and statement of the endoscopic treatment that has been applied. ESGE recommends that symptoms or signs suggestive of iatrogenic perforation after an endoscopic procedure should be rapidly and carefully evaluated and documented with a computed tomography (CT) scan. ESGE recommends that endoscopic closure should be considered depending on the type of the iatrogenic perforation, its size, and the endoscopist expertise available at the center. Switch to carbon dioxide, CO2, endoscopic insufflation, diversion of digestive luminal content, and decompression of tension pneumoperitoneum or pneumothorax should also be performed. ESGE recommends that after endoscopic closure of an iatrogenic perforation, further management should be based on the estimated success of the endoscopic closure and on the general clinical condition of the patient. In the case of no or failed endoscopic closure of an iatrogenic perforation and in patients whose clinical condition is deteriorating, hospitalization and surgical consultation are recommended.